So you went to the ER because of severe back pain or symptoms shooting down the leg. You may have also had numbness in the saddle area of your buttocks, or weakness in both legs, or maybe even loss of bladder control, like incontinence or urinary retention. They evaluated you, they examined you, but they sent you home and you still have these symptoms. You may be asking yourself, what do I do next? In this video, I'm going to show you the warning signs that you should not ignore if you have an L4-L5 or L5-S1 disc bulge or herniation, when you may need an urgent medical reevaluation, and what your next steps may be once an emergency or an urgency has been ruled out. Let's get started. Hi there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada, and this channel is devoted to people that have been suffering with chronic spinal conditions like disc bulges, disc herniations, stenosis, scoliosis, bad posture, radiculopathy, numbness, tingling in the arms and legs, and just haven't found answers elsewhere. And also help people introduce them to corrective, non-surgical methods to resolve these problems. So if you want to see more of these videos, do subscribe right now because I upload videos on a regular basis. Like this, you don't miss out on many of my new upcoming videos. So there's a couple things I want you to get from this video. And I've been wanting to do this video for a very long time because I have another video that's one of my most popular videos on my channel. You may have seen it, about warning signs of severe and advanced disc bulge and disc herniations. And it's very popular. And the most frustrating thing for me is that many people commented on there, said they went to the ER and then were essentially checked and then just sent home and did now not know what to do from that point forward. So I want to go over some points that I think should be at least considered if you're in that situation. So number one, first understand that the ER is there to do one job, and that's to take care of emergencies and urgencies. So once they rule that out, then their job essentially is done. It doesn't mean you don't have continuing problems, but that's their job. And I understand that having severe back pain, leg pain, even urinary problems or bladder dysfunction can be very frightening when you don't know what to do with that or what the outcome may be. But always remember that the role of the emergency department is to determine if there's a medical emergency present in the moment. Now, if they discharge at that point, it doesn't necessarily mean that nothing is wrong. There's no problem. It just means that in their eyes, it's not a medical emergency and a medical urgency. And I can understand how frustrating it may be. And a lot of my patients have been through that, so I totally get it. The other thing too about the ER is that it's not a place where they're going to administer musculoskeletal care. They're not going to give you care for your back and leg condition. They're just there to do urgent emergency work. And if it requires immediate surgery, then that's the place to be, obviously. Now, the second point I want you to understand is that just because you were discharged from the ER, it doesn't mean you need to ignore the problem, especially if there's new symptoms coming on or if they're progressively getting worse. So in that case, now it's a different situation that needs to be checked. Again, you need to visit the ER if bladder's function is worsening, if numbness in the buttock area is worsening, if you're getting weakness in both legs, if you can't go to the bathroom and have a bowel movement. These things need to be checked because those are serious advanced symptoms of disc herniations in the lumbar spine that if they get worse, it warrants a new checkup and a new evaluation. So don't feel like you shouldn't go back there. Now, I want to review again the signs and symptoms that do continue to require a medical evaluation, in some cases an urgent ER evaluation. So if there is new or significant change in bladder or bowel control. Now, I want you to understand why this is important, because the lower lumbar nerves, if you look over here, they go to the colon, they go to the bladder, okay? They go to the pelvic region, and they also form into the sciatic nerve and branch out into the legs. So if there's weakness in both legs, shooting pain in both legs, if there's loss of bladder control, loss of bowel control, urinary retention, urinary incontinence, numbness in the saddle area of the inner thighs and buttocks, especially if they're progressively getting worse, those warrant an immediate, urgent medical checkup in the ER. Okay, in the ER. It's very important. So that's a review of those symptoms from the last video that I had. So again, new loss or significant change in bladder or bowel control, new numbness or altered sensation around the groin, genital, buttocks, and saddle area, new or rapidly progressing weakness in one or both legs, increasing difficulty standing, walking because of neurologic weakness, or you're just collapsing because of neurologic weakness, rapidly worsening neurologic symptoms. Let's say your legs give out, or if you notice eventually at some point there's muscle atrophy or shrinking of muscles in your thigh or calf. Those are signs of neurologic deficit, okay? Other warning signs, of course, if there's significant trauma, that's obviously something you have to get checked. And any other clinical red flags that have been identified in whatever clinical history you have, that needs to be brought to the attention of a ER medical doctor. Okay, so next point. So now you're probably saying, but I already went to the ER. I went once, I went twice. It's the same thing. I still believe they need to know what's going on. Push it a little firmer. Make sure you get the necessary care that you need, because if these symptoms are increasing, progressing, they're a new scenario, they need to know about it. You need to get this evaluated. So you still go get that checked. It's very, very important, especially if there's worsening neurologic conditions. Tell the healthcare provider about your new status, what's going on, and make sure that you're cleared of any serious bladder, bowel, organ system dysfunctions that need urgent medical attention. So you got to be clear of that at the ER. It's very, very important. And also make sure that any other symptoms that you're presenting with are not minimized or dismissed. So that should all be brought to the attention of that ER medical doctor. Okay, so you have these serious symptoms. You went to the ER once, twice, 3 times. You're frustrated. You're upset. They really didn't do much. It's not a medical urgency or emergency in their eyes. It's not requiring surgery. What do? Well, you should still go consult with your medical physician and request a specialist with a neurosurgeon or a neurologist, a specialist if it's outside their realm, to get this evaluated further. Just don't give up. I know it's frustrating because sometimes you feel like you're left behind or abandoned sometimes in these situations, and that's what all these comments are showing under that last video on my channel. And I get it, but you cannot give up, because if these symptoms continue to get worse, the actual consequences are very, very serious. So progressing symptoms are just not good. They have to be evaluated. So go to your doctor, get a specialist appointment, get new updated imaging. If you had an MRI 6 months ago or 1 year ago or 2 years ago, you may require new updated MRI images. That's very important. I'll talk about where conservative care plays into this in a moment, but you have to go through all those steps before you even get into conservative care. So now I want to talk about where conservative care and chiropractic care, because I am a chiropractor, comes into all this. First and foremost, all emergencies, all medical urgencies have to have been evaluated and have to have been ruled out. There should be consultations set up with specialists, new imaging required. Once that's all done, if there is still those neurologic problems going on, there still may be a place for conservative care, corrective chiropractic care, in conjunction with working with other doctors and specialists in communication, looking at all those reports. So I would still work with that patient. However, you would still have to be in the loop with all the other medical evaluations. That's super important. And then chiropractic care may include, as long as it's indicated based on an examination, analysis, MRI, analysis of x-rays, neurologic checks, all the tests have been done. Depending on the scenario, you can still take care of the spinal segments above and below those disc injuries that can help with function in those local areas, relieve irritation on those discs and nerves in the local area, improve mobility and function. That just generally helps the overall healing process. Eventually, you can get into exercise as well. But again, all the conservative options have to be added later on once the urgencies, the medical emergencies, and all of this have been ruled out and all the special appointments are in line, because you need to have all those still followed up on. So just to wrap this up, 4 key takeaways. Number 1, is there a potential for emergency or serious condition? That needs to be evaluated first. Number 2, if symptoms are now worsening, do you need a further medical evaluation? Of course, the answer is yes if they're worsening. Number 3, once the serious conditions have been appropriately ruled out, very important, then you want to start continuing to figure out what's actually causing the ongoing back pain and leg pain. Of course, if all the medical situation has been ruled out, a corrective care chiropractor may be able to help with that. So it's still warranted to have that in your repertoire of professionals that are looking after you. And number 4, is the condition appropriate for conservative care? In co-management with medical management, the specialists, or in combination with that, and maybe even physical therapists at the same time. So co-management is very important. Multimodal treatment has been shown to be have more successful outcomes for people with chronic spinal conditions and degenerative disc disease and disc herniation, disc bulges, than just isolated treatment. So it's very important. So the whole point about this is, don't let the fact that if you've been to the ER previously and they just dismissed you, all it means is that they didn't really see it as a medical urgent necessity for whatever reason in their evaluation. But don't lose hope. Continue to get reassessed by your ER again if necessary, by your medical doctor, by a specialist, and then look into conservative care options like a chiropractor that may fit into that. If you found this video useful, leave a comment below. Let me know about your journey. Let me know where you're at with this. I know it's very frustrating, and when you comment, other people can see that and know that they're not alone in this. Also, if you think this video was useful, like and share. It helps YouTube get out to more people that may need it. And then I'll put a link over here, the video that I'm referring to about the severe signs of disc herniations, right over here. So you can go watch that again if you haven't seen that, or as a review if you want to, right over here.